Hi, everyone. We're going to go and get started. Thank you so much for attending our clinical education information session and being the clinical instructors and SCCEs for our students. I'd like to introduce myself. My name is Dr. Kimberly Sisto. I am the Director of Clinical Education here at Spalding University in our physical therapy program. So, just to let you guys know a little bit more about me, I've been here at Spalding a year and a half. Our program is new, so started my first venture into academia in June of last year. I am a board certified specialist in sports physical therapy and kind of got there through practicing at Nationwide Children's Hospital, where I started my career. I worked there for about 6 years and worked on developing their sports residency, and then took a job here in Louisville after my husband, that's there on the left side, got transferred for work into Louisville. And I started working at Norton Women's and Children's Hospital, also working in pediatric physical therapy, but I also ventured into pelvic health due to the huge demand here in Louisville, and my interest in doing that and continued interest in orthopedics in the pediatric setting. So just a little bit about my personal life. I have two little boys. One is 5 and just started kindergarten, and the other is 3. I am a native of Columbus, Ohio, so grew up a Buckeye, but I did the silly thing of going to Michigan for graduate school. So everybody gives me a hard time because I went to University of Michigan Flint, and I grew up a Buckeye, and I'm a lifelong Buckeye fan, true to my Buckeye roots. But I get it on both sides. I don't know what I was thinking. But it's so nice to be with you guys and meet all of you. I really appreciate you spending the time to meet with me today. I know you've got busy schedules and lots going on in your day, so I appreciate your time today as well as your time coming up for our students' clinical rotations. So I want to give you a little introduction about Spalding University and our PT school. So here's our beautiful new building located on campus. It's really set up for our students to come in, as we are a hybrid program, to come in for their labs and be able to do on-campus work. And then since we're a hybrid program, we do a portion of our education for our students online. The mission of our program is to prepare our students to be compassionate, caring, and skilled physical therapists committed to lifelong learning and engagement in their community and leadership in the profession. So the CoSARE for Kids School of Physical Therapy and Center for Interprofessional Education is a home to Doctor of Physical Therapy program. Our Spalding University has several different graduate programs. We have nursing, athletic training, occupational therapy, professional psychology, and clinical mental health counseling. So it's a really great environment for our students where we have so many opportunities for interacting with other students in different programs and learning more about collaboration with other programs. So it's been a wonderful way to engage with each other, and we've used our new beautiful facility to interact with the various programs on campus. Our labs are taught, as I talked about earlier, in our newly renovated downtown facility here. And it has over 22,000 square feet with PT skills labs and student study areas. And so here's a picture of our patient care skills lab. Got a nice big open space. And then we've also got pictures of our wet and dry anatomy labs. So those are just some examples of our spaces. If anybody ever has any interest in checking out our facilities or anything like that, we'd be happy to give you a tour and are planning on, in the not too distant future, having an open house. So we'd love to have you all over and let you see our facilities and get to know some of the faculty and staff. And two, if you ever are in the area and would like to to meet up with us. We're happy to schedule a time to meet up with you all and meet you. So I wanted to introduce you to our faculty. So our program director is Dr. Jason Ashby. He has over a decade of teaching experience in both PT and PTA programs, including the University of Findlay, where he was most recently. He has been a clinician director of physical therapy in the outpatient settings in orthopedics and then the home care settings as well. And he primarily teaches our orthopedic and musculoskeletal content. Dr. Lisa Zuber has been a physical therapy educator for over 2 decades. She is or was the associate director of the Department of Accreditation at the APTA for 12 years. And then her teaching responsibilities include professional engagement, cell systems diseases, diagnostics and pharmacology, and critical inquiry. And then Dr. Gautam Singh has his PhD in physiology from the University of Louisville and did a fellowship at the CoSAR for Kids Center for Pediatric Neurorecovery at U of L. He is heavily involved in research when he's not teaching and does non-invasive neuromodulation to promote motor recovery in children with spinal cord injuries. So he's doing some amazing stuff, amazing research, and he has recently spoke at a combined sections meeting last year. And he is primarily teaches our anatomy and physiology coursework in the program. So some of our adjunct faculty include Jade Bender-Burnett, Pawan Sharma, Mackenzie Wilson-Faree, and then Daniel Birch. And then you all are faculty too. So you guys are our clinical faculty members, and we just want you to know how much we appreciate the huge role you play in our students' education. And I just want to say that I really want to do everything I can to help you guys be as successful as you can and provide any resources and make sure that communication is open and you guys feel free and comfortable to interact at any time. I'll give you my contact information at the end of this session. But don't hesitate to reach out anytime with any questions, anything. I am here to be a resource to you. And by no means are you an inconvenience in any way. I know I've been a CI and I know it can be hard to get a hold of DCEs and interact with them. And my goal on the other end, because I know what it's like to have a challenging student, is to be there for you all and to make sure that I'm there to support you all and help you guys succeed as instructors. So we appreciate you. So upon the completion of being a clinical instructor, we'll make sure that you guys have access to Spalding University's library resources. So that includes any textbooks and anything that our students have access to. We'll also give you a gift card, and we'd love to hear any continuing education that you guys are interested in, but we're planning on doing continuing education courses and at little to no cost to you all. So if you guys do have any wishes for continuing education, things you'd like to see, I have a post presentation handout for you guys to fill out. It's just a form on Google Docs. And I just like you guys to fill out for me on there if you have anything that you're looking for advanced education or additional information about in the setting of PT. So our program is about 3.5 years, and our academic year begins in August. Our students finish and graduate in May. And we have a hybrid teaching model, as we talked about a little bit earlier. So our students have asynchronous learning. So they work on things like lectures, assignments, videos, and they have interactive programs that they do during their asynchronous time. And then each class meets for at least a week, at least an hour, sometimes 2 hours, synchronously for instructors to interact with the class. And really, that's a time for students to ask any questions and then apply the skills and things that they've learned during their asynchronous time. And then labs are 1 week, and we say about every month during the program, and they're from 8 to 4. The labs are not conducted during their students' clinic rotations, and they really do have minimal coursework, if any, during their clinical rotations, because we feel like it's very important that they're focused on what they're doing in the clinic and making sure that they're prepared and not bogged down with a bunch of other coursework during that time. So why the hybrid approach? So our students today are different than they have been previously. Our students are working other jobs, have other responsibility, and so we want to recognize that and make sure that we allow students to have more flexibility in, their road and path to become a physical therapist. So our schedule allows students a bit more flexibility with their personal schedules. And it allows our interactions and time spent together, whether that be in lab or synchronously, to be more focused on the application of material and the difficult content. And then it allows for a variety of different teaching methods. So we can use more electronic forms and online forms of ways to engage our students, which we all know the world is becoming more and more, electronically based. Um, our students are able to come from various places throughout the country. We have students in Florida, Mississippi, Louisiana, all over. Since it is a low residency hybrid program, they're able to come for just 1 week a month and just stay with us and then go back to wherever they are. Um, and then for our program, there's no bachelor's degree required. Students can start after they have completed all their prerequisites and have done 90 credits of undergraduate coursework to kind of shorten that time they're in physical therapy school. And by the time they've graduated, they'll have a bachelor's in health science and then also a doctor of physical therapy. So now to the bulk of things, clinical education. So our mission for our students is that they're exposed to a wide variety of different patients, condition-wise and in different settings and of different ages. So at minimum, this includes an inpatient rotation, an outpatient experience, um, and one one with a focus on neurological population and one with a focus on the musculoskeletal population. So the setup for clinical education begins in the student's second year. So during fall of their second year, they begin with a 4-week clinical, which is the one you guys will be working with our students on. They'll be in the outpatient setting, outpatient orthopedic setting. And then they'll progress to fall of their third year into an inpatient setting, and that's an 8-week rotation. During their third experience, that will occur during the summer of their third year in the neurologic rehab population. So they could either do that in the inpatient or outpatient setting. And lastly, there's a 12-week specialty rotation. And we want students to use that as a rotation where they really are thinking about what they want to do. Maybe, I have some students that are really interested in sports physical therapy, so maybe putting them in a more sports-based clinic, or some that are really interested in more inpatient rehab, so making sure that they have extra time in that setting. So when they do graduate and get into the workforce, they're ready to go. But we do want to also be cognizant that they are well-rounded as they graduate and are exposed to all different settings and ages and different conditions too. So if any student we feel like is struggling in a particular area or needs a little bit more exposure to a certain area, we can use that rotation to do that as well. And please feel free if you guys have any questions as we go through. I want this to be really informal. Don't hesitate to reach out and raise a hand or anything like that. So we use Exxat for all of our clinical education resources and content during our physical therapy program. Um, and this allows me to collect site information and get your instructor availability, make student placements. We have you complete evaluations as clinical instructors, and our students also complete their evaluations there. I have you have access to our clinical education handbook there and different resources. And then this also allows me to track compliance documents and then share those with you. So that includes things like immunizations, certifications, background checks, and drug screens. So what I'm going to do real fast is share our site resource page because I just want to show you guys that so you're aware of it and get more of an idea of what that's like. So I'm going to stop my share real fast and share a new screen here. Alrighty, so right here is the Exxat portal. And if you go to the site resources page, you get a lot of different information about our program. You'll get our clinical education schedule here. It has all the different rotations that our students will be going out on and their dates. Um, and then you can also use this like little, they call it a hamburger over here on the side or this back button to navigate. But resources for clinician under course specific may be something that you will find especially helpful during your students' rotations. So I posted the PowerPoint from today's clinical education information session on here. And I will also send out a link to this site so you guys all have that if you want to refer to it. But that's there and you just click view documents and there you'll be able to see, as long as it loads, our PowerPoint that we did today. There's my contacts letter that I gave to you guys with any information about student placement in their site. There is some training videos and Exxat is a fantastic resource. I don't know how many of you are um, familiar with it. A lot of programs use it. But the Exxat training video is on there for the CIET. There are various other training videos too, if you're not familiar with the Exxat platform. And then there's also a CIET training that's a YouTube video for using the Exxat platform. So I highly recommend that so you guys know how to use a CIET on Exxat if you have not done that before. I have a sample CIET form there, our clinical educator handbook, our DPT course line. So if you guys timeline, if you guys are wondering what courses have they had and what courses will they be taking, that's in there. I will be posting this recorded presentation onto our YouTube channel, and I'll also send that out in my email to you guys following up after the session. There's information in general information for CIs and SCCEs. And I wanted to highlight this because I think it will be super helpful for all of our CIs. It just has information about what our students have completed coursework wise. So you also have a better idea of what they've done and what to expect from them, but we'll also go through that a little bit more during this presentation. Um, but yeah, there's also information too about just communication, our expectations for our students, and their tasks, their assignments, things that they need to complete. So you're aware of those and what they'll be doing or asking you potentially for during their rotations. So I'm going to hop back to my PowerPoint presentation and share this screen. Try this again. There we go. Okay. So, for show of hands, how many of you guys are familiar with the CIET? Have you guys had any training with the CIET? Had any students with the CIET before? No. Okay, perfect. So the CIET is something that we're using and we've decided to use instead of the CPI, which a lot of PTs are very familiar with. But CIET stands for the Clinical Internship Evaluation Tool. And why we're using it is because it's quite easy to use. We feel like it's less complex than the CPI. There's less redundancy as a CI. I use the CPI over and over again, and I felt like I was repeating myself about 10 times throughout the process. So I'm hoping that with the use of the CIET, that you feel like this is less redundant. It also takes less time to complete, and we all want to be very cognizant of your time as clinicians. I know it's big to take on having a student, and so we want to make this process as easy for you as possible. And then the scales are for grading, I believe, are better defined than the CPI. So to give you a little bit more information about what clinicians have said and CIs have said about the CIET compared to the CPI, most CIs, if you look at this chart right here, say that the CPI, that's in blue, takes anywhere for, as a maximum. I'm sorry, the CPI is in the orange and the CIET is in the blue. So if you look at the blue, 30 minutes or less, or 30 to 60 minutes is generally what clinicians are spending when they do the CPI or CIET. When they're doing the CPI, there's anywhere ranging of, 30 minutes, which I'm really impressed that people can do that. But, we're seeing most people are saying 60 to 75 minutes really that they're spending doing that CPI. So our goal is to have you guys spend less time and be able to do this more efficiently. And then also research has asked the question of what do clinicians and CIs prefer? And the CIET is shown that more students and also clinical instructors prefer the CIET to the CPI. So pitfalls of the CPI or CIET, I'm sorry, is that there's less research and that it's not quite as well known as the CPI. So I want to introduce you all to the CIET. So there are several sections. There are 4 sections of the CIET. So there's standards for professional behaviors. There are standards for patient management, comments on areas of concern or strength, and then global rating of student clinical competence. There are areas for comments in the areas of concern or strength for the CI only. And that includes examination, evaluation, diagnosis, prognosis, and intervention. So the first section is standards for professional behaviors. So these are all big red flags for us. All of our students should be, except with the exception of communication with patients and other medical professionals, we expect them to be always demonstrating the frequency of expected performance. So we'll talk a little bit more about that. So there are 19 questions in this area related to the behavior of both the CI and student. So the safety behaviors address whether the student is following all the health and safety precautions required at your facility, along with taking any other measures needed to maintain both the patient's safety and their own safety. Professional ethics addresses the student's knowledge of and compliance with all rules, regulations, ethical standards, legal standards, and professional appearance and conduct in the clinic during all interactions. Initiative addresses the student's ability to maximize all opportunities for learning during their rotation, including problem solving, seeking out and accepting and implementing constructive criticism, and developing teamwork and flexibility in the clinical setting. And then communication skills looks at their verbal communication with patients, families, other healthcare professionals, along with their written communication in the form of documentation, home programs, and any other required paperwork. So In addition to answering questions for these skills and behaviors, there's also an area for the student to comment about their performance in this section. So the professional behaviors are graded on a scale of the frequency the appropriate behavior is noticed. So the occurrence of appropriate behavior is rated on a scale of never, which means it's not there never. The student never shows it. Rarely would be less than 25% of the time. Sometimes is 50% of the time. Most of the time, 75% or greater, and always is 95% or greater. As I reported earlier and spoke to you guys earlier, we're not expecting this necessarily for communication as documentation and patient communication. We expect to improve throughout the students' clinical rotations and clinical education experiences. So our next slide here just kind of shows the setup on the Exxat platform and shows that there are the different sections of for safety, professional ethics, initiative, all of those things. So if you look at this, it shows the safety section of the standards for professional behavior, and it has all of the questions for the student and the CI to rate. So one of them is follows health and safety precautions. And so you'd use your rating there, takes appropriate measures to minimize risk of injury to self, takes appropriate measures to minimize risk of injury to patient. So you're going to go through and just click. And it's just pretty easy. You just click each one and then go on to the next. And please don't hesitate to reach out if any of this is confusing, doesn't make sense to you. I'm happy to help you guys and get on a Zoom call and go through it with you. So here again, as I talked about, here's where you are going to use your rating as a CI and rate whether it's never, rarely, sometimes, most of the time, or always. And then there's a section for comments that we just spoke about earlier. So the student's going to have their own midterm comments, and then you'll have your own midterm comments. And what will happen is the student will not be able to see your comments or what you say until you guys have your meeting together. And they'll assess themselves before you potentially assess them. So it will not be shown to the student until you guys have your meeting together. So in the standards for patient management, this includes examination, evaluation, diagnosis, prognosis, and intervention. So for examination, this includes things like obtaining a history, systems review, performing tests and measures. Evaluation is the analysis and synthesis of data gathered during the diagnosis and plan of care for the patient. The student should be able to demonstrate development of critical thinking skills during the evaluation process of patient management, including determine the patient's impairments and functional limitations. In the diagnosis and prognosis, it determines a diagnosis for physical therapy management. So that's your physical therapy diagnosis, not just your medical diagnosis. Determines the prognosis or outcome expected for the episode of care. Determines the appropriate frequency and duration of care, including any criteria for discharge, and determining appropriate treatments. And then intervention is the student's ability to apply treatments and perform any education, monitor patient response, and progress them throughout their plan of care until their outcome is reached. So for patient management grading, it should be compared to a competent clinician who is able to skillfully manage patients in an efficient manner to achieve an effective outcome. So you're going to compare it to that. So you say they're well below that competent clinician. They're at that level for familiar patients. So maybe low level, low complexity patients. at that level for all patients. So your more complex patients, ones that may have multiple medical complexities and issues, and then above what you would expect for, a competent clinician who is effective and efficient. So right here, you'll do the same thing as where you can give overall comments about anything related to the student's um, examination, evaluation. You'll be able to do that for each one of those bullet points there. And then you'll be able to give them a global rating of student clinical competence grade. So you'll put that on a numeric scale of 0 to 10. And it has, 0 being well below a competent clinician, and then 10 is well above a competent clinician. And then after you've completed all that, it'll ask a few questions like, is the student performing at a level that is satisfactory for their current level of education? And that kind of flags us to have additional conversations for sure. And then a signature from you all to make sure that you guys have discussed it and completed it. Um, so additional evaluations that I'm going to have you all do during during the rotation would be the PT student evaluation of the clinical instruction. So they're going to have to review that with you. They'll do that at the midterm and final, and then we'll have you sign that off. The PT student evaluation of a clinical site. So again, they'll review it and have you sign that off. And then also the clinical instructor evaluation of me, the DCE, and the educational program, so we can get some feedback from you all. So working in the clinic, I know several times we had these conversations where I had a coworker say, "Hey, what are we allowed to be in another like room, or can we be in another area and not really see our patients when our students are treating them?" And the definition of of direct supervision is to be physically present and immediately available for supervision. In both cases, the physical therapist or PTA will have direct contact with the patient or client on each date of service. So those are really the the rules that you really need to abide by to make sure that you protect yourself in terms of your license. And this was provided by the House of Delegates. So here are just some brief recommendations for success. I'm sure you all have had students and had some, experiences, but being very communicative with your student before the rotation and even throughout the rotation is incredibly useful, especially since these students are on their first rotation. So this is all new to them and this is a new experience. So the more instruction that in introductions you can provide to them, I'm sure the more they will benefit and really appreciate that. At this point, students should have sent an email to their SCCE and potentially their CIs to get more information about their schedule, their dress code, any material that you guys would like them to review to be ready for their rotation. Students are not to ask the CI or any of you all for time off. They need to clarify with me first. So the Thanksgiving holiday is also coming up here. So we'll have to be cognizant too. If you all are scheduled to work on the holiday, they've been told that they will work on the holiday. And they've been told to have that conversation with you guys. But please just let me know. And our students are responsible to let me know. Let me know if you have any concerns with our students. But the students are responsible to let me know what their schedule will be. An introduction conversation with a student can be very helpful, kind of a get to know you, to know your student's background, their interests, their experiences, how they prefer to get feedback, what the structure of your day is, what your clinic is like, and then your goals and expectations for your student. I really loved when I was a CI doing the weekly planning forms. I felt like those were so helpful to keep my student and I on track, and make sure we were working towards a common goal and we're thinking on the same lines. So I think that's a great time, is just to have regular conversations with your student to go over a weekly planning form. Giving your students a tour of the site. Um, Again, constructive criticism is very helpful. So not only, letting students know this is what you did wrong, but this is how I would do it, can be very helpful. Um, Setting objectives and expectations. So letting them know, at the beginning of the week, this is what I'd like you to be able to do by the end of the week, or this is what I'd like you to do today. And those can be very helpful things in getting you both on the same page, and then accomplishing your goals. Um, Professional behavior. So just making sure that you let students know what your expectations are, for any interactions with other support staff and things like that, guidance with them, and how you want them to interact with those. That's very important. Um, and I found with my students, kind of asking them as we go through their thinking process of what may be going on with a patient, what tests or measures we want to perform, anything like that. It can be really helpful to guide them through that process and give them questions while they're going through, to make them kind of think, but you them kind of give them the tools to start learning how to think those, have those questions for themselves as they go. um, Provide specific feedback to students. So, think of making sure that you have specific, immediate feedback for the students. Of course, we want to be cognizant of not interrupting a treatment session, but as soon as it happens, we know that providing a more immediate feedback can be something that our students learn from better and are able to apply better in the future. Um, you can explain too, sometimes giving students an explanation of the why of what you're doing, and why you chose to do a treatment, can be very helpful. So these are the things that expect our students to be able to do during their first internship and when they're working with you all. So they should be able to introduce themselves to the patient, create a safe environment for the patient and the therapist, assist with the completion of a subjective history. So they may not be super skilled in digging into the deep and nitty gritty, but they should be able to perform a basic subjective history. They should be able to document a basic treatment note. They can do manual muscle testing, goniometry, soft tissue massage, vital signs, gait instruction, gait analysis, functional movement analysis, palpation of bony landmarks, and integumentary examination. Um, and they also can do postural analysis. I'm noticing that's not on there, but they can do that. And they should, I would really recommend starting with like less complex patients, for the students to interact with. So our expectations for the first internship, and at the end of this first internship, we expect our students to be always for the professional ethics portion of professional behaviors, most of the time for safety and initiative in their professional behavior, sometimes for communication, and then receive ratings of well below or below for any skill of the patient management on the final PT-CIET. And we'd like to see that they're showing improvement from the midterm to the final rating on that visual analogy scale, that we showed earlier. So communication wise, we expect our students to be able to work towards really not using medical terminology, using more layperson terms, and appropriately, conversing with patients. And also, at this point in time, we really feel that students may take a little bit longer to do their documentation. It may be a little bit more wordy and less precise, but that should improve. And biggest thing that we want to see also is that our students are really improving as they're working with you and progressing. during their second clinical internship, I won't go through too much with this stuff since it won't necessarily apply to this internship, but I want you guys to see the structure of our clinical education. And during their second internship, I want to make sure that they can do a thorough chart review, including diagnostic imaging, have a more thorough subjective history and systems review with more non-complex patients, and then have examination and treatment of patients with more simple musculoskeletal, cardiovascular, pulmonary, integumentary, geriatric, and neurological conditions. So as the students progress to their second rotation, you can see that our expectations increase, and we expect them to perform higher on that CIET with higher ratings. Similarly, same thing for their third rotation. And then during their final rotation, I'm expecting that they always are following benchmarks for professional behaviors. They have no ratings below always for, well, just professional behaviors. And then at that level for patient management, for all patient types on the CIET. And then on the visual analogy scale, they get a final rating of at that level or higher. So they, are what a competent, effective, efficient clinician would be. So, additional opportunities that would be great for our students during their clinical rotations would be being able to see or observe any areas of specialty PT practice, whether that be, if you do a lot of dry needling, or if there's pelvic health and a student's interested in that, vestibular rehab, anything that your facility really specializes in, that ability for them to observe a therapist for even a couple hours, 1 or 2 hours would be fantastic. Any surgeries would be great for them to be able to observe that. Working with in a multidisciplinary setting, so seeing interactions with speech language pathologists, OTs, doctors, that's all helpful experiences for our students. And then involving them with the supervision of and coordination with any of your support staff and working on the communication with them is also something that can be really, really helpful and valuable for them. So during our clinical rotation, students' clinical rotation, I will do a site visit or another faculty member. If you guys are out farther away, we do have a student that's placed in Florida, so we'll be doing a Zoom visit there. But I want to make sure that I get around to everybody and get to have a good conversation with you all one-on-one. So I'll meet with the CI and then the student as well. And it will be about an hour long. So we'll schedule that far ahead of time. If you guys even wanted to schedule that as far, now I'm fine with that. So I'll reach out to you towards the beginning of the rotation if I don't hear anybody reach out to me sooner. But please don't hesitate to reach out if you'd like to get that on the books. And then I may have to, if there are any concerns or anything like that, I'm happy to do a follow-up conversations with any of you all. But the biggest thing is, I want you guys to know that I'm here to support you. We so appreciate everything that you are doing. Anytime that you feel an inkling of the student's really struggling, or I have a question about this, or should they be doing this, I am here to be that person to help with that. So please just don't hesitate to reach out. I will be as available as I can to you via phone. I'm in the clinic on Thursday, so that's my only day that I'm not quite as available. But I will definitely get back to you within a few hours if you reach out via email or phone. Again, I know it can be hard sometimes to get hold of DCEs. And I want to make sure that you guys all are able to get in contact with me and don't have any issues with that. And we're able to work together to provide the best experience for students. just some reasons that I want you guys to reach out to me. Any red flags are super important that you reach out to me as soon as possible. So if students have attendance issues, they're showing up late or taking time off without approval, they have inappropriate conversations with either patients or you as a clinical instructor, if they're arriving unprepared, if you have any assignments that you've given them that they're not doing or they're not reviewing, they're not coming prepared. Any issues with safety. So they're not adhering to any precautions or contraindications or not properly guarding. Um, a lot of students, the most common issues for them to struggle with can be behavior, inadequate skills or knowledge, and poor communication. So, those are areas that if you do feel like, oh, this student seems like they might be struggling a little bit with it, don't hesitate to reach out because I'm happy to provide any support and resources to you and the student to help everybody be successful. So with that, does anybody have any questions? Just got a few more minutes. I don't want to take up too much of your time, but I really appreciate all of your time today.
I had a question.
Yeah.
I take Tuesdays off to watch my son.
Yeah.
Will my student follow my schedule? Because I'm the only PT here. We do have a PTA, but
Okay.
we come
So
in.
yeah. So how many hours do you work?
I work, I think it's 32 hours of treatment time.
Okay. And then do you do other stuff? You do have other managerial tasks or something that you're doing your other
No,
hours or yeah.
no, it's just I have a pump break and it's 30
Okay.
minutes twice a day.
Yes.
And so,
Gotcha.
yeah, I take
Gotcha.
time.
No problem. Yeah, so we'd like to, why don't we take this conversation through email and we'll chat with each other that way. But I'd like to get as close to that 40 as possible. So we'll figure out a way to get your student up to that 40.
Okay, thank you.
Yeah.
Kimberly, I was just curious how many students are currently in the program?
Yeah, so in this cohort, we have 9 students.
Okay.
And then in our next cohort, that will be going out next year, we have 6 students. So we're starting out small,
Okay.
but building up. Yeah. Yeah.
Okay. And is this the first full year? Is that correct? What you said at the beginning, correct?
So
Or is this your first cohort?
this is our first cohort that's coming out. So
Okay.
they're in their second year of their
Correct.
coursework.
Okay.
Yeah. Right. So I will be sending out something for you guys to fill out, a survey just to kind of let me know my performance and any suggestions you guys may have. And also if you guys have any clinical education or I'm sorry, continuing education that you are interested in, I'd be happy to work on trying to get those opportunities together for you all. And after you've completed that, I will send you a certificate for your CEUs. And if you guys don't have any other questions, that'll wrap things up for today.
Thank you.
All right, no problem.
Thank you.
Bye, you all. Thank you.